You're there. Awesome.
Okay, great. Thank you. So, thank you, everyone. It's a really pleasure to give the talk. Actually, I started to participate in the meetings just a few weeks ago, and I hope to bring new insights and new information, and it can have a new point of view in the science for you. So let's move to the talk. I will share my screen now.
Is it okay if we interrupt you with questions while you give the talk?
Yes, please, please. Feel free to interrupt as much as you want. Actually, I really enjoy the discussion, and I think it's the most important part, actually. So just just interrupt and ask. It's not a problem. Um, um, Today I'll talk about photobiomodulation, and it's from bench to bedside because I start my research in the basic aspects of photophysics, and it delivered. I started to accompany bright photomedicine based on my PhD. So it's bench to bedside, but now it's back to because new insights in quantum biology makes me to go back to the bench. So it's a little bit of that I would like to discuss today. Here is just a little timeline. Uh, I made part of my PhD. I was visiting research at Harvard Medical School, and my advisor was Michael Hamblin, that is one of the big names, and we wrote this handbook that is a very important book in the area of photobiomodulation that previously was known as low-level laser therapy, and together with Tanupia. So sometimes we talk about that book during the presentation. Today, I divided the presentation in three parts: the science and technology, majorly my research in photobiomodulation therapy for pain management. The second part is the innovation and entrepreneurship that is more related to the developments that I made to build a company over the scientific research that I have previously done. And the third part is a discussion about quantum biology and how it relates to photobiomodulation therapy. And this third part is much more, as I name it, a discussion. We have a lot of questions and very few answers. So it would be very good to have a very nice conversation on that. To localize ourselves, we'll talk about photobiology, that is a huge field, but specifically on photophysics and photochemistry. And inside of photomedicine, the low-level light therapy, that is now is known as photobiomodulation. As a technology, we are in the field of biophotonics, that are the applications of the use of light and photons as a technology development inside of in biological aspects. And specifically, we are dealing with therapeutics, but there are several applications in imaging, biometrics, detection, and surgery. And to localize ourselves in the spectrum, we are talking about visible light and near infrared light. We are not dealing with far infrared that is related to thermal. So the photobiomodulation is not photothermal therapeutics. And we are not talking about ionizing radiation starting from ultraviolet. So it's just the effect is really connected to photophysics and photochemistry of interaction of light, photons, and molecules. There is a therapeutic window that is very important to say because in red and infrared, we have a bigger penetration of light that is in that region from 600 nanometers to 1000 nanometers approximately. There is that optical window. And it's here, it's very interesting because in that image, that picture, we see here the fingers are red because there is a candle in the other side. And it's interesting to call the attention that the penetration of light depends on the wavelength. So in that region of therapeutic aspects, we have photodynamic therapy, that is the association of light and a drug, a photosensitizer, and in near that region we have ultraviolet therapy for jaundice and ultraviolet sterilization, but we will focus here on photobiomodulation therapy. That is basically the interaction of photons in the mitochondria to increase the production of reactive oxygen species that work as signaling, and ATP that increase the production of the production of ATP. It allows the cells to produce several endogenous substances that are useful for therapeutic aspects. Here, it's just to show you that there are several applications and several mechanisms of action. Actually, I will send the presentation to the organizers so they can share it, and I will not go through any of that. It's much more for reading for the ones that are curious about that. And here just I will go over that, but only to talk that photobiomodulation has applications in all types of tissues and organs and systems in the body and in all organisms, as we see it, as it is related to mitochondria stimulation. So it's so broad, the number of applications. Actually, today, it has 20,000 papers wrote about photobiomodulation, and 80% of them were written in the last 10 years. So it's a field that is really increasing. In nerve tissues, not only in the brain, but in peripheral nerval tissues also, it's possible to have that type of modulatory effect. And actually, it was the place that I worked in the decreasing of the pain. Okay, if someone wants to ask us, just ask.
Marcelo, I don't have a question, but can you turn off the fan because it blows to the microphone and we hear that noise?
Okay, thank you very much.
Thank you.
Yes, just to let you know, I'm the northeast of part of Brazil, so it's really warm here, but it's totally possible to be without the fan. It's not a problem at all. So we are, as I told, just overviewing that epithelial tissue. So there are several applications and results that were already researched, and it's very well explained, some of them, and several organs too. As I told, I will not go, it's just an overview of the broadness of applications of photobiomodulation. But now talking about the pain mechanisms, that is the really part that I would like to focus in that presentation. We have basically some type of stimulus, nociceptal stimulus, like an injury. It releases several substances in the body that some of them are able to excite nociceptors, that are the neuron terminals that conduce pain, and it goes to the spinal cord and go over up to the brain, and the brain, it is interpreted as pain. So to work on that, I made several researches on how light distributes and in the rat brain, because it was my model. So doing that, we were able to really discover how the amount of photons that are absorbed in each part of the brain of the rats, and to calculate attenuation and the index of attenuation. So we really discovered with very good precision the distribution of light in that tissues. So the second part of that was to correlate the amount of light that are absorbed in each part of the brain of the rats and mouse to the behavior of the animal when it was treated transcranially. It's actually my advisor, Michael Hamlin, he had worked on that previously, and it became a very important part of his research in the years after I was with him, and we worked together on that for up to today, actually. And basically, it's a translational type of therapy. Today, there are approval of FDA to work with photobiomodulation in several aspects of therapeutics, like traumatic brain injury, depression, and it's increasing the possibilities. And even in the transcranial applications to inhibit the nociception in the peripheral system, as it was the work that was based on my PhD thesis.
Question?
Yes, please, Paul.
So are what you're talking about have to do with whether it's CW illumination, pulse modulated, and those factors of the laser illumination that exist, do they influence the efficacy of the effects that you observe?
So I don't know if I understood, but
well, let me explain. Lasers can be delivered as continuous wave, or
okay.
they can be delivered in a pulse format with different pulse properties, such that the power per pulse can be varied. And I'm wondering how those parameters influence the efficacy of the observable effects.
Very good question. Actually, it was demonstrated that for several applications in the brain, pulsed waves, usually it is done with that cycle of 50%. So it's just a square wave, the turn on, turn off, with a frequency of 10 hertz. It has better results with the same average power than the continuous waves for applications like traumatic brain injury and even to nociception also. But another interesting thing is that with 100 pulses per second, it is very similar to continuous waves. So somehow it's like the biological system, it do not cannot distinguish between 100 pulses per second and continuous waves. But for a few pulses per second, around 10 hertz, it has an improvement on the results. Here I worked with continuous wave in 810 nanometers, applying directly transcutaneous and transcranially in the brain of the mouse. It was a power density of around 300 milliwatts per square centimeter. That is not enough to cause thermal damage, but it was enough to have very good results in changing the way the mouse behave in pain in pain models, like for example pain caused by cold or by inflammation, heat or pressure. So we had an increase in the pain threshold. It means that after the irradiation, here the baseline, the zero in the timeline, is before the photobiomodulation, immediately before. And here we have measurements on the pain threshold, 1 hour, 2 hours, 3 hours, 6, and 1 day after the irradiation. We used the control group that is black, a group with a very little power density, actually very little time, so a total energy that is small, and a group that was adequated, the dose based on the previous work that we had done in the dosimetry of the brain in the rats and mouses. So with the adequated dose, we had an increasing of 3 to 4 times in the pain threshold. So the animal was able to manage much better the pain stimulation without respond to that. We saw the same behavior in the tests with cold plate and the radiant heat in the tail. So in the cold plate, he can remain much more time with the cold, and in the radiant heat, it remained in average much bigger time. And in the injection of formalin, that is a type of test for inflammatory pain, we saw that the animals remained with the paw up much less time. So it means that they were feeling much less pain than the other groups. We saw changes in the tissue also. We did a confocal microscopy associated to fluorescent antibodies to measure the amount of glutamate that is related to a biomarker for pain, and we saw a decreasing in the treatment groups. And PAP, that is a prostatic acid phosphatase, that is endogenous analgesics, that it was really increased in the treatment group. Another interesting thing is that we do not saw difference in the concentration of tubulin in the cytoskeleton, but in the images, we were able to see varicosities, and that varicosities, it is postulated to change the dynamics of molecular motors inside of the neurons. We didn't not yet worked on that direction, but it's a very interesting thing that we would like to research in the near future. And as it was known previously, there was an increase in free ATP that is related to the mechanism of action of photobiomodulation. So we were able to see a 90% increase in the ATP that were free to be used to produce the analgesics and consequently decrease the pain signaling. Here are some of the immunohistochemistry images that we saw in the control group, seeing that the glutamate and the analgesics endogenous and the tubulin. Another very important thing is that we do not saw any type of thermal damage in the surface of the brain. So we could conclude that transcranial photobiomodulation really could decrease the pain signaling, do not change the concentration of tubulin. And so it was really effective to pain management. And these were the basis for it was the previous work to encourage me to start a startup.
Quick question.
Yes.
If you look at the action spectrum around the wavelength that you used, around 808, how wide or narrow is the action spectrum?
Yes.
Because that may give indications of what the agent is that's absorbing the light and giving the behaviors.
Yes, actually the cytochrome C oxidase, it has two peaks, one around in the red, I think it's near 630, and the other that is near 850 nanometers. And they are broad enough to have effects that goes from red in 600 nanometers up to 1000 nanometers and be excited by that wavelength. But an interesting thing that I will talk in the end of the presentation is that that mechanism of action based on cytochrome C oxidase is being attacked right now because some folks are saying that it could not be the whole explanation. Of course, we know that there are others photoabsorbers, but right now there are some folks that are postulating really quantum biology effect as the main action mechanism for photobiomodulation.
So you don't have the experiments repeated at different wavelengths around 808, for instance?
Yeah. Actually, in my research, I only use it near of that 808, 810. But right now in my company, we are using 850 nanometers. But there are several groups working with different wavelengths, and many of them have very good effects, but it's necessary to change a little bit the power density in order to, depending on the wavelength, in order to have approximately the same amount of absorbed light to trigger the biological effects.
So there's been no systematic study where the wavelength has been varied, keeping power constant around, let's say, from 750 to 900?
No, in animals, but in cell culture, there are several studies like that, that to focus it on the biphasic dose response that exist for several wavelengths. If you choose a specific wavelength, it has a biphasic dose response. If you increase the power, you are getting better results up to the peak, and after that it starts to decrease. And there are several studies in cell culture that they were varying the wavelength from 5 to 5 nanometers, 10 to 10 nanometers to create that type of curves.
Oh, thank you. Just one quick question. In the cell culture, do people actually blank out the mitochondria? So for example, you can illuminate in a pattern where you avoid all the mitochondria of the cell, and then specifically illuminate the mitochondria and look at the response of the cell culture system. Has that been done?
Oh, you are a spoiler, man. Actually, yes, there are several studies in that direction. And another very interesting type of study is to not only to blind the mitochondria, but specifically what were thought was related to cytochrome C oxidase inside of mitochondria. That is the complex 4 of Krebs cycle. And there are folks like, for example, Marlon Scully that were a few weeks ago in that meeting that studied what happens if we focus in complex 3 of the Krebs cycle. And so they studied specifically that molecule and could not find the same results, the positive results that they have in complex 4. So it's, how can I say, it's a field that it came from medicine to physics to biology, because people started to do that type of procedures much before to know any type of mechanism of action. So actually the systematic studies, the mechanism of action search, they are really increasing the last 10 years. In that aspect, it's a very new field for physicists, but it was a 50 years old field for physicians and physical therapists and therapists in general.
Thank you.
You are welcome. So in that part of presentation, I will talk a little bit about the innovation and entrepreneurship, and it's really different from the type of presentation that I saw in that meetings, but I really would like to talk about it because I believe it's interesting, the movement that is happening in the world to make closer the scientific research and the market in general. So I will take just a few minutes to talk about it. As we study specifically applications for pain, that if we talk about the world, it's $1.5 trillion per year, only with diseases related to musculoskeletal system. And pain is the #1 thing to disable people in the United States and probably in the whole world. But the main therapies are based on drugs, but only 1 out of 4 people have access to the right drugs. And even that's 25%, that is the risk to become addicted to drugs, as we see in many countries, the opioid crisis, and several other comorbidities. So what we are doing or trying to do actually is to make the physical type, the therapies based on energy as reliable as therapies based on chemistry, I mean the drugs. Photobiomodulation, it depends a lot of the dose. It's related to one of the explanations is related to cytochrome C oxidase, as we talked before, and it's necessary a huge precision to have the biological effect that we are dealing. But usually, someone that started to work with that 5 to 10 years ago, they only saw that type of table, and it's only focused on white Caucasians, so it's not good enough. And what our team in Bright Photo Medicine is doing, it's use that type of Monte Carlo extreme softwares and simulations to produce simulations that taking in account the characteristics of the the tissues, optical characteristics of the tissues, like refraction index, scattering and absorption coefficients, and anisotropic index, in order to simulate perfectly the tissue of every individual and have that type of simulation taking account the color of the skin, the thickness of the fat tissue, and the level of hydration of the skin. So several parameters that change the penetration of photons, and we can simulate that for each individual in order to have exactly the same amount of light that is absorbed in the target tissue. So it starts to become possible a systematic research on that, because imagine that if we have a very little difference in the color of the skin, you have a difference in the amount of light that is absorbed in the target tissue that is under the skin. So without that type of individualization of the dose, it is not possible to make systematic research on that. So it's really important, even the methodological aspects of research, to do that type of individualization. So as I told, we can take in account the phototype of the skin related to color, melanin concentration, the thickness of the adipose tissues, and several other aspects that are going to improve our methodology. Right now, we have a partnership with Instituto DOR of Research and Education in order to take images directly and to calculate the type of characteristics directly for magnetic resonances and tomographies. Here is just an example in the knee that we already did it, and that's really improved the dose calculation. We had done a clinical trial in osteoarthritis that we were able to demonstrate a decrease in pain that was around 50% of the decrease in 85% of the patients. Here, the photobiomodulation therapy group compared with the placebo group, and it remained for up to 6 to 7 weeks after the end of the therapy. So here is the number of sessions, and we use it 2 sessions per week. So here we have folks that suffer with chronic pain caused by osteoarthritis for 20 years, and in 2 weeks, it could decrease a lot the level of pain. So they were very exciting results. We have a tendency of increasing in dopamine in the urine in the patients. So we believe that if we could keep working on that, we will be able to find some biological markers in the blood, in the urine, or even in the biopsy of the tissue. And having that type of feedback, we can improve even more our dosimetry to produce even better results related to that biomarkers. Today, the process of creation of a new photoceutical, that is basically the digital therapy based on photobiomodulation. It's done together with scientists and physician and an investor and the know-how of Bright. And we create that and validate in clinical trials to upload in a Bright store, that is a virtual store, and can be downloaded by the physician, and it goes to the device. So when the device applied to the patient, it delivers the perfect amount of light in order to have the best biological results. And in terms of business model, we do not sell devices. We sell the dosimetry that is customized for that disease and individualized for that specific patient. So the photoceuticals that we are creating is the interface between photobiomodulation and the digiceuticals that are the digital therapies. It has, it is personalized, has no side effects, it's painless, no chemicals, and it's not invasive. It is prescribable. It has predictive results, and it was refundable, at least here in Brazil. We hope that we will be able to do the same in the United States. And the whole idea that we are dealing with is to create a systematization of research and systematization of science, technology, innovation for energy-based therapies as the same level of quality that today there is in the drug development. Here's just the investment trail that we had. We already had around $200 million invested in the company. And just few takeaways, we employ several scientists in our team. We applied around 700 digital remedies based on photobiomodulation per month. It was more than 1,000 people treated by us, and we are open to a new round of investment. Please, Paul, go ahead.
Oh, I think Margaret has her hand up first.
Okay, I'm just seeing you.
Oh, okay. So my question is, does it have to be laser, or do you get the same effect with an LED and also, let's say, a superluminescent LED? Because in terms of cost, LEDs were a lot cheaper than lasers. And if it works the same, it also says something about the mechanism that it doesn't have to be a coherent light source.
Perfect, perfect. Actually, it's not necessarily to be a laser. I use a laser in my PhD, but in my company, I use LEDs. As you told, it's much cheaper and have the same capacity of results. Today, we have a lot of very good LEDs that are very near to monochromatic, and there is no thermal effects, so it's possible to use LEDs. That's not necessarily lasers. And the idea, it's much related to the absorption of photons. So no matter the source of photons, at least to the vast majority of applications. Actually, I always like to say that Niels Finsen won a Nobel Prize using the filtered light of the sun. So it's possible to have a very good result no matter the source. The important is to have a very good dose. Please, Margaret and David Decker.
Hi, so sorry, this is a while back, but you were mentioning the skin color, and I was a bit surprised. I mean, is 800 nanometers absorbed by melanin?
Actually, yes, it is. The main thing is the scattering also. So it's melanin absorbs in 800 and 900 much less than in the visible light, but it's relevant to probably it's the coefficient of absorption is 10 to 20 times smaller than in visible light, but it's
would that matter at the intensities you're using? I mean, I'm just, I was a bit surprised by that, that's all. So.
Yes, actually the intensity, it's very small intensity because we could not cause thermal damage. So we are always less than we are around 100 to 200 milliwatts per square centimeter. More than that, it's dangerous to warm the tissue. So for the vast majority of photobiomodulation, it's less than 100 milliwatts per square centimeter.
So the other thing was about this, what absorbs? I mean, it's not cytochrome oxidase, or there's a discussion about it, but I gather the action spectrum doesn't fit. So what else could it be? Or maybe you're going to get to that later, so you can just move on if you're going to talk about that.
Because there was a very exciting paper last month talking about that. Unfortunately, I doesn't bring it here, but talking about several chromophores that we have in your body, specifically in that paper, in your skin. So the explanation based on cytochrome C oxidase, it's how can I say, it's almost falling. So
it sounded weird to me right from the start, so it's good.
Yes, because actually it's how can I say, let me show it. Quantum biology, the death of a dogma.
Okay.
This paper was written by Adam R. Master, that is a son of the master that was the founder of photobiomodulation 60 years ago. And basically they are defending that cytochrome C oxidase as the unique explanation. It was a dogma that was put and people keep repeating it, but it could not be the only explanation. There is a very nice paper of Sergei Moskvin, that is a Russian researcher, as important as Michael Hamblin for the Western world. He is for Eastern world. He demonstrates hundreds of different wavelengths with very different biological effects. Many of them are not therapeutical, but we are not talking about therapy now. We are just talking about the photobiology. So several wavelengths that really change, really modulate something. So an explanation based on only one chromophore, it's no longer possible. I hope few months, few years from now, we could have a much better explanation on that. Please, Dave, I hope it have answered Margaret.
Thank you.
Okay, thank you very much for your question. David, please.
So is the pain reduction local only or systemic? You know, for example, I saw you wrap around somebody's knee for an arthritic knee and maybe it makes their knee feel better. But if they had low back pain, would it make their low back pain feel better?
Very amazing question. What I did in my PhD was to apply directly in the brain and to test the pain behavior in the mouse in several parts. For example, in the forehands, in the back legs, the back paws and the forepaws of the mouse, in the tail, with pressure nociception, inflammation nociception in different parts of the body, and we saw a decrease in the whole body, in the pain in the whole body, applying directly in the brain because it's related to the interpretation of pain in the system. Another important thing is when we apply in the local of the pain, for example, in the clinical trial, we applied photobiomodulation in the knee of patients that we are treating pain in the knee. So it's local. It do not have any effect or very good effect in other pain, for example. A lot of patients have pain in the knee, osteoarthritis in the knee, osteoarthritis in the shoulder. So we must treat two of them when we are doing local treatment. But very nice thing, the neurons, they concentrate, they make synapses in the spinal cord, and some of the bodies of the neurons are in ganglions that are very superficial in the dorsal root ganglions here in the spinal cord. So when we apply photobiomodulation in that dorsal root ganglion, we could have a decrease in the pain in the whole area that is innervated by that neuron. So it's really cool to start to treat the pain, for example, in visceral organs that are not possible to be illuminated transcutaneously because we go just 1, 2, 3 centimeters maximum with power enough to be therapeutic. So it's a very exciting new field. We hope to work deeply on that with our association and partnership with Redor, that is the biggest network of hospitals in Brazil. And we hope to do a lot of clinical research in order to correlate the basic aspects of the science with the major therapeutic applications. So in a short, it can be local, but it can be systemic if we treat directly in the brain or in cervical or in the dorsal root ganglions.
So that means that it's a local effect, but if you hit anywhere along the neuro pathway to the brain, you have a pain in the knee and you put the light back here, any place along the signal transduction of the pain in the nervous system, you can interrupt the pain.
Yes, but there is a decrease in the attenuation of pain. We could not find yet a perfect setup in order to have a really good decrease in pain applying just transcranially. So in the clinical practice today, we apply it locally and transcranially and in the dorsal ganglion. So for the usual practitioner, it's a combination, because we could not yet be able to do transcranial modulation that it's good enough to do not need the local attenuation of pain.
Okay. And have you started with the FDA yet?
Actually, not yet. We are working majorly in Brazil, but right now we are closing an investment, and we will go to United States. I hope in the near future to start to work that. But in United States, we have very close collaboration with folks in Harvard, and also in Bethesda, that is a military hospital that I'm sorry, I couldn't remember the name. It's Juanita Anders is our partner there.
Walter Reed.
Excuse me?
Walter Reed.
Perfectly, exactly. So we have very good collaborations in the United States, and we hope to improve it. And of course, I really would like to have that type of bridge with all of you. A nice thing that we have here in Brazil is the possibility to do clinical trials much cheaper than United States. So it's a good complementarity to do basic research in United States and clinical trials in Brazil, because we can use the best of the two countries for research. So just we are already having a very good discussion, but just to put a little bit of spicy on that, about the quantum biology, and that just a historical aspect.
Marcelo, sorry
please.
to interrupt. It's JC here. I think Meryl Togerian has a question as well.
Oh, sorry. It's because I'm not seeing everyone here. So please just ask.
Thank you. And thank you, Marcellus, for a wonderful talk. I'm a pain researcher. My lab is in New York at the City University of New York. And we've been doing pain research for quite a bit. And we're interested in different models, including like bone trauma, traumatic brain injury, neuropathic pain, back pain, you name it. And as you mentioned, and as we know, is that there's a lot of heterogeneity, more so than in the preclinical models. In the clinic, there's heterogeneity, and no one knows exactly what's going on in each patient. And you mentioned the need for this personalized approach in terms of adjusting the different parameters of treatment. However, the basic science work tells us that there's really a very diverse set of mechanisms that are responsible for pain, from one mouse to another, from old to young, different strains, male versus female, acute versus chronic. So if a treatment is working on all of those things, or relatively well in all of those things, kind of like opiates, let's say, right? You're made to think that either it's targeting something that's really common for all pain medicines, or it's targeting something that's really higher up in the hierarchy that's shutting things down. Now, if you're administering the therapy peripherally, the second alternative is no longer logical, right? So you would imagine the first alternative is at play. However, you also mentioned that it could work systemically, but to a lesser degree if you're applying it, kind of like TMS in the brain, and kind of resetting things or shutting things down. So it really opens up this idea of what's happening mechanistically. You showed some biochemistry in terms of some inflammatory modulation, perhaps, but I really, I'm struggling to understand how it could possibly work, because one of the things we study in our lab is we study how pain becomes chronic by altering the brain. And once that happens, we can intervene in the periphery as much as we want, but we don't succeed almost because pain now lives in the brain. And there's going to be a lot of remodeling, let's say, in the brain to reverse a lot of these pain-related adaptations. And that takes time. And we don't, like you mentioned, we don't even know where it is in the brain to target it. Every week there's a new paper saying it's this area, it's that area, but we still don't know. And probably it's all of those areas in different ways. It's this scary puzzle. So I'm thinking, could it be that this treatment would be better suited for acute stages of pain, where pain could be more easily directed in the periphery? And once it's chronic, unless we know more about what's happening in the brain, perhaps it's best not to mess with it, even though it doesn't maybe have very obvious side effects, but we really don't know, right? Anything that changing something should have side effects in an individual where there's no anomaly, right? If it's fixing an anomaly and you give it in an area that doesn't have an anomaly, it should have a side effect, right? So how can you know who has the anomaly and who does not, right?
Okay, actually, that's the other part of my research, that is pain, because I study, of course, photobiomodulation, but the other part of my interest as scientist is the pain management. So for sure, we have a lot to talk to. The thing is, thinking like with the brain of a physicist, the pain system should be understood as a complex system by itself. So making an abstraction of wondering only the mechanisms of pain signaling and the pathways from the body to the brain and from the brain to the body. We have a lot of interferences that changes how it works. So I totally agree with you when you say that it's very difficult to move something without side effects. So when I talk about side effects, to be more precise, I would like to say we do not saw any side effects, at least yet, at least today. And the other commentary about the applications in the acute phase and the broadness of the results and the applications. One thing that we talk about a lot is that the photobiomodulation, in many times, it's not solving the pain, the chronic pain, but it's changing the signaling of pain from the signaling interpretation of pain, the signaling from the peripheral system and the interpretation in the central system. So the vast majority of clinics applications, not research, but clinic applications, it's only local to change the signaling of pain from the peripheral system to the brain. In terms of the changes in the brain caused by the chronification of pain, that there are a lot of changes in functionalities that people see it clearly in the magnetic resonance imaging, functional resonances, I mean. We would like to make a research on that, to evaluate if we could, for example, decrease the chronification of pain and decrease the sensitization of the central nervous system. So it's a thing that I never saw any type of research in that field of neuromodulation using photons. So it's a very cool thing that we would like to research, and probably we will have that type of insights using functional MRI. And with that new partnership with Head Door, we will have access to several MRIs that can be very insightful in that field and the interpretation of pain.
Thank you.
So just to go further on that, that's a little bit of historical, and as I told, Niels Finsen won a prize, Nobel Prize, using the photons coming from the sun, and Master was one of the founders of the field using the low power laser, and he was able to see hair growth in mouse and healing in the wounds in the 90s and in the beginning of this century. NASA used a lot of LEDs to improve. And now the thing that we are doing in bright photomedicine is use that type of industry 4.0 technologies in order to individualize the parameters of the therapy. And all of that is focused in increasing the precision of the irradiation. And as I told, it's fought in cytochrome C oxidase. But right now, there is folks that are studying how basically that cytochrome C oxidase is not the whole explanation, and that dogma should be dead. And quantum biology has more to do with that, and basically it's postulated some changes in the surrounding of big proteins that is elicited by the photons.
Quick question.
Yes,
So pain is a useful signal telling us that something is wrong. So are there any examples where you have two effects, which is not only a reduction in the perceived pain, but an effect on the causative process that leads to the pain, such that, let's say, you reduce inflammation as a result of the treatment, in addition to reducing the signaling of the pain?
Yes, actually, in the example of osteoarthritis that we studied a lot in the clinical trial, we have two more very good, very important effects. That is the decrease in inflammation and the decrease in the velocity of degeneration of the cartilage. That thing related to the cartilage is a thing that we have to study much better, because we were not focusing on that in the clinical trial. So it's a new finding that we will work on that. But the thing about turning off pain, it's not related. It's not like that there is a whole blockage of pain. So it's important to have a diagnosis before to start to applying photobiomodulation, and it's a thing that we do it, and we know that around the world there are several possibilities to simply buy a device and do it at home. But it's not the thing that we believe that is the best, because someone can, for example, apply himself, decrease the pain, but that pain could be the signaling of a cancer or other type of disease. So it's very important to know what is causing the pain before to treat it.
Right, but this complicates trying to identify a mechanism, because it would be easy if it's just affecting nerves and nerves only and the signaling of pain, but that appears not to be the case. So one has to look for a more general feature that's common to a wide class of cell types,
Yes.
to understand where the action is.
Yeah, totally. Because exactly as you are telling, we could not separate the neurons from the rest of the body. Actually, there are some culture studies that, for example, the researchers were able to see, for example, the decrease in the frequency of action potentials in a cell culture, or the increase of specific substances only in that type of cells. But in the organism, it is not possible to separate one thing from the other. So it's really complicated to know precisely the action mechanism perfectly. So in some aspects, biology can be very different from basic physics in this aspect that we couldn't. It's very hard to separate apart from the whole system, so it's I totally agree with you. It's very difficult, and maybe it's impossible to have a complete theory explaining a little photon will be absorbed right here in that molecule and have a trigger of be a trigger for a fall off effects. So what we have is really an average of what is happening.
Thanks.
And here, just to keep adding some aspects of quantum biology, the studies of femtosecond transients in absorption spectroscopy that were done from this group, and even Marlon Scully that were talking here. It's important to try to really discover what is the trigger. Somehow it's like the field of photobiomodulation is a little bit stuck because we are not being able to go a little bit deeper. We have an average over the tissue, and we understand the effects from the tissue to the whole organism. But we could go a little bit deeper and know what is happening perfectly in the cell, perfectly in the macromolecules, and even in specifically in the absorber part of the molecule. So doing that, I believe that we could go much further the understanding of the quantum biology aspect of photobiomodulation, and doing that, we would be able to have a much more effective therapeutics. And another aspect is the production of new light sources to be applied in photomedicine, like quantum dots. Just to have an idea, it's people believe that is $20 billion opportunity of business, the using of quantum dots in photomedicine. So it's huge in the point of view of marketing, but it's huge also in the point of view of science of materials and new light sources, and the improvement of the understanding of the photobiology by itself, and the quantum biological aspects that are related with that. So that was what I had prepared, and of course for me it's a really pleasure. So please make questions and we can keep the talk.
All right. Thank you so much, Marcelo. Please, let's give a round of applause. This is a very fascinating subject.
I have to admit that I was really afraid to talk with you guys because I saw the level of presentations before, and it's a very high level. So I'm very, very proud to be here with you and to receive that applause.
We're very happy that you're here giving this talk for us.
Jerian has a question, I think, because her hands are raised.
Oh, yeah, please go ahead.
Or not, maybe she just left it up and we can proceed.
Yeah, I apologize if I miss your questions. My computer is dead, so I'm logged in from the iPad, and sometimes I cannot see very well whose hand is up. So if I don't call out your name, please shout out or someone let me know. But yeah, so as usual, we welcome trainees to ask the first questions.